I'm here to introduce Dr. Ellie Campbell, and we're going to get right into the topic about how your dentist and your doctor might work together to help you work out your problems that you may be experiencing with heavy metals. We're going to review why heavy metals are a problem, how you might get tested for that, what they do to your health if you don't address them, and then how can you alleviate your body of these heavy metals. Dr. Ellie Campbell and I work together. We're outside of Atlanta in a suburb, and Dr. Campbell is board certified in family medicine and has been practicing for almost 30 years.
So I thought for our audience today, we would try to talk about maybe 5 things. We want to talk about toxins in today's world. We want to talk about what mercury specifically as a toxin is, where does it come from, and what the impact of mercury is on our health, how we can avoid mercury toxicity and reduce our toxic exposure, and then how to treat it if we find it. And we'll talk about the smart removal technique that dentists use and the chelation that mostly medical doctors are privy to. So there's no secret to most people probably in this audience that we live in a toxic world. Our tap water, our skin lotion, shampoo, even house dust are filled with synthetic chemicals. We know that there's at least 14,000 chemicals that are grouped together in different groups that are known to be toxic. And the EPA has identified over 83,000 industrial chemicals that are registered for commercial use, and thousands and tens of thousands more that are used and aren't registered. But yet of these, the National Health and Nutrition Examination only tests for 150. So we have this toxic burden, and we're only looking for a tiny fraction of all the things that can make us sick. And in almost every study, heavy metals top the list, with arsenic and cadmium being on the top, but heavy metal mercury is another very significant cause of human suffering. So
I know my health department doesn't even really test for heavy metals. So this is, a lot of people just don't even know if they have a load.
Right. It's commonplace in pediatrics to look for lead, but that's the only one they look for. Our University of Georgia has a extension office that will do testing of your water. But I sent a patient to go specifically test their brand new well for heavy metals, and they asked for the most extensive test, and it did not include heavy metals. They didn't know the right question to ask, or they didn't have the code number for the test, because the extension office will check for lead, arsenic, and mercury, but you have to ask for it. So it's hard to test for in the environment. It's even harder to test for in humans. Mercury is a toxin, and many of us, when we were kids, had an opportunity to play with this liquid mercury. It's one of the few heavy metals that is liquid at room temperature, which makes it really fun, and it dances and it breaks up into these little circles, and it's a fun thing to look at. If only we had known it was toxic when we were cracking open thermometers to play with the mercury that was leaked out of the broken glass. But it is a poison that's recognized as a chemical of major concern because it's a dangerous threat to public health. It accumulates in the body over time unless you're very aggressive at detoxification. So a little bit now, a little bit later, a little bit in the future, all accumulates together. And it turns out that those silver fillings that we see in our mouth are called dental amalgams, and they contain about 50% mercury. So they are one of the major sources of mercury, and it's the mercury vapors that are more dangerous. They're more easily absorbed through our soft tissue. So every time we bite on a fresh mercury filling, we're emitting vapor. Every time we heat that up, we're emitting vapor. So they get to be more toxic because of those usages. There are potential sources of mercury. We've talked about amalgams, but fish and shellfish are known to bioconcentrate mercury in their flesh. So if we eat fish, the meat of the fish, then we will be exposed in some cases to mercury. We'll go over which fish are the worst in a bit. Vaccines containing thimerosal. There's not much thimerosal in vaccines anymore, but any people who had vaccines earlier in the 80s or before may have gotten exposed to thimerosal in their vaccination. Mercury thermometers we talked about, and a common source that people don't think about is in these energy-saving fluorescent light bulbs. They have mercury, and they're safe as long as it's inside the bulb. But once the bulb is broken, because you had an accident in the house, or you put it in the trash and cracked it open, now you're exposing the environment to mercury. So those are a future dangerous source of mercury. And then breathing in vapor from industrial spills. And there are some indigenous Ayurvedic traditions that use mercury in their health rituals. So as we talked about, they are cumulative over time and can become pretty serious.
My understanding is if you had the amount that is in 1 gram, 1 paperclip worth of mercury, and you put this in a 10-acre lake, if this were made just of mercury, the EPA would say you shouldn't eat the fish in that lake, in a 10-acre lake. It would be that, it's that toxic.
Yes, and yet many dentists, not Dr. Amy, but many dentists will put mercury fillings in your teeth. And if you have the amount of mercury in your mouth equivalent to a paperclip, you couldn't drink the water for the rest of the life of that lake. So what about it? You think it's doing to your body? Well, the major way that mercury is toxic is it's toxic to brain and nerve cells.
How mercury causes brain neuron degeneration. Mercury has long been known to be a potent neurotoxic substance, whether it is inhaled or consumed in the diet as a food contaminant. Over the past 15 years, medical research laboratories have established that dental amalgam tooth fillings are a major contributor to mercury body burden. In 1997, a team of research scientists demonstrated that mercury vapor inhalation by animals produced a molecular lesion in brain protein metabolism, which was similar to a lesion seen in 80% of Alzheimer's diseased brains. Recently completed experiments by scientists at the University of Calgary's Faculty of Medicine now reveal, with direct visual evidence from brain neuron tissue cultures, how mercury ions actually alter the cell membrane structure of developing neurons. To better understand mercury's effect on the brain, let us first illustrate what brain neurons look like and how they grow. In this animation, we see 3 brain neurons growing in a tissue culture, each with a central cell body and numerous neurite processes. At the end of each neurite is a growth cone where structural proteins are assembled to form the cell membrane. 2 principal proteins involved in growth cone function are actin, which is responsible for the pulsating motion seen here, and tubulin, a major structural component of the neurite membrane. During normal cell growth, tubulin molecules link together end-to-end to form microtubules, which surround neurofibrils, another structural protein component of the neuronal axon. Shown here is the neurite of a live neuron isolated from snail brain tissue, displaying linear growth due to growth cone activity. It is important to note that growth cones in all animal species, ranging from snails to humans, have identical structural and behavioral characteristics and use proteins of virtually identical composition. In this experiment, neurons also isolated from snail brain tissue were grown in culture for several days, after which very low concentrations of mercury were added to the culture medium for 20 minutes. Over the next 30 minutes, the neurite membrane underwent rapid degeneration, leaving behind the denuded neurofibrils seen here. In contrast, other heavy metals added at this same concentration, such as aluminum, lead, cadmium, and manganese, did not produce this effect. To understand how mercury causes this degeneration, let us return to our illustration. As mentioned before, tubulin proteins link together during normal cell growth to form the microtubules which support the neurite structure. When mercury ions are introduced into the culture medium, they infiltrate the cell and bind themselves to newly synthesized tubulin molecules. More specifically, the mercury ions attach themselves to the binding site reserved for guanosine triphosphate, or GTP, on the beta subunit of the affected tubulin molecules. Since bound GTP normally provides the energy which allows tubulin molecules to attach to one another, mercury ions bound to these sites prevent tubulin proteins from linking together. Consequently, the neurite's microtubules begin to disassemble into free tubulin molecules, leaving the neurite stripped of its supporting structure. Ultimately, both the developing neurite and its growth cone collapse, and some denuded neurofibrils form aggregates or tangles, as depicted here. Shown here is a neurite growth cone stained specifically for tubulin and actin, before and after mercury exposure. Note that the mercury has caused disintegration of tubulin microtubule structure. These new findings reveal important visual evidence as to how mercury causes neurodegeneration. More importantly, this study provides the first direct evidence that low-level mercury exposure is indeed a precipitating factor that can initiate this neurodegenerative process within the brain.
So it's no wonder that the predominant symptoms of mercury, unlike lead and cadmium, which more have kidney and liver and lung effects, mercury has neurologic side effects. So loss of peripheral vision, if those neurons are in your eyes, that pins and needles feeling in your hands and around your mouth, lack of coordinated movements, impairment of speech, hearing, or walking, muscle weakness. And in children, if they're exposed to methylmercury, which was the kind that we mostly get in fish, while they're in the womb, may experience impact on their thinking, memory, attention span, language, fine motor skills, and visual spatial awareness. So commonly we see these kids in the clinic and we'll end up referring them for ADD evaluation, for occupational therapy, for physical therapy, when in reality the real problems that they were suffering from mercury toxicity. So it's something that we need to have a high level of suspicion for, and then start testing and treating appropriately. So how are some ways you can avoid mercury, and how can you treat mercury toxicity? Well, it's important that you see your dentist if you have amalgam in your mouth and you need to get them removed. Not all mercury has to be removed immediately, but it should be evaluated by a smart, trained dentist. And have your doctor get tested for mercury and other heavy metals, because they often are found together. ZRT Laboratories is a colleague of mine in Oregon, and they have a home test. You can prick your finger and squeeze it onto a piece of filter paper and send it to the lab, and for about $130 you can do a home test without asking your doctor if your doctor's not educated in this specialty. Of course, avoid exposure to mercury. Don't play with broken thermometers. Don't eat certain fish that is known to have high mercury levels. Avoid handling and properly dispose of your fluorescent light bulbs. And then do not participate in rituals that use mercury-treated herbs or supplements. And then consider amalgam removal with your dentist. It's important that you have, probably if you have a mercury problem, 2 practitioners. One will be a physician like me, trained in heavy metal evaluation and chelation, and one is a dentist like Dr. Amy, who's trained and experienced in heavy metal removal through the SMART program. So what is the SMART thing that we keep talking about? I'm going to turn this over to Dr. Dayries to finish the conversation, but it's basically 3 things, right? We're going to protect the patient, we're going to protect the dentist and the staff, and then we're going to protect the environment.
This is something that we've been doing for years, the SMART program. It's been created by this professional organization that I'm a member of, the International Association of Oral Medicine and Toxicology, lots of letters, IAOMT. And this is an international organization. We have a strong presence here in the United States in all 50 states. You can go to IAOMT.org and find a dentist in your area who supports doing the SMART protocol. One of the things I love about their website is they do have a transparency there, so you can see how much training in holistic or biological types of dental treatments the dentist that you're looking at has. So it's not just where you could just sign up as a professional like some organizations are and never actually put in work, but this will show the education levels of the various dentists and the services that each practice will offer. So I was just going to go through what we do at our office. So this is a 49-year-old patient, a male, ex-military, had a number of amalgams, or in other words, these mercury, silver, other metals are in the amalgam to copper, tin, and zinc, placed when he was in the United States Navy. A lot of our military don't get choices about materials they want in their mouth. This guy being 49, of course, these were placed when he was, in his late teens, early 20s, and military decides what's going to be best for you, and you're in your service there. So he wasn't on any medications, but sometimes medications can interfere or impact metabolism. So we look at the person's overall medical and dental history And there is a vitamin protocol that a lot of the patients want to take. And the point of the vitamin protocol before you get your amalgams out is to get your liver as highly functioning and to strengthen your immune system. So that being said, I usually kid around with our patients too that we don't want you to be a binge drinker and binge drinking before you come in, because that's going to heavily tax your liver. And I am kidding with that, but a lot of people get nervous about dental work. So it has happened before where I've had somebody come in and they're a little tipsy in preparation for their dental appointment. So if they express that they're nervous, we have a chat about other ways to manage their anxiety before they come in or when they come into the office. So we traditionally have had x-rays. This slide shows a non-digital x-ray. These days we use digital x-rays, and this is an example of a silver mercury filling. This one is beginning to leak. It doesn't have the white tooth silver filling look. It has a little area on the bottom of your screen where there's a grayness there, and that's where the amalgam is beginning to break down. So some people advocate getting out all of their amalgams because they're trying to be as proactive and alleviate their heavy metal levels in their body load. Other people want to, as one needs to be replaced, they want to just replace it with something that's going to be healthier. So we follow, as I mentioned, the SMART protocol, and we talk about vitamins with our patient to see, how deep do they want to go into the protocol. Being a protocol that's published by this organization, if a dentist offers it, they really should offer every patient the same treatment options, and then it's really up to the patient, how closely they want to follow it. There are several books that are published by this the people that run the SMART protocol. One is called Dentistry Without Mercury, and the vitamin protocol actually comes from this book. So we have copies of the book at our office. We offer it to patients if they want to read it. And then we have an informed consent that discusses, we could be stressing your health system when we take these out, and we just want you to go in with your eyes wide open if you're ready to do this. If somebody is sick, chronically sick, that's a lot of times when they seek us out to have these done. Other people, like I said, want to just get it out because they know it's potentially going to be taxing their system, and they may not have been tested for heavy metals. If you have somebody that, maybe they are going through some health problems, they're not feeling well, and they have maybe just a few of these, and they're in good shape. Some of those people want to do a heavy metals test before to see how badly they're taxed with heavy metals. Dr. Campbell mentioned a blood test, but I also recommend a scan called the Oligo scan. It's out of Luxembourg. That's OLIGOSCAN. We have it at our office, and it gives you a quick turnaround of what your body load is. So you can decide if you're really high, that might make you want to be more proactive in getting these out. Or if you're not feeling well and you've been battling some chronic problems, maybe you want to consider how long do you want to wait before you might get these out? Or do you want to wait till these need to come out because they're absolutely breaking down and the tooth's falling apart? I think it's a really good thing for yourself, though, to get these out when you can. So the Oligo scan tells you your tissue load. Some people advocate for a urine test, which will show what you're excreting. And some people have traditionally given a surfactant called DMSA, which we'll touch on later in the presentation. It acts like a soap, and it helps pull the heavy metals from your tissue. The average heavy metal test will test you for around 13 different metals, including arsenic, lead, mercury, cadmium, cesium, a variety of them. And the tests vary a little bit in which ones they test for. So obviously we're primarily focused on silver, mercury. There is some copper, tin, and zinc in these, but we're really mostly focused on overloading of silver and mercury when we're looking at these. So we do a restorative history. We talk about your health history with you. In this case, this patient on the right, you see a page here where they had a urine version of the heavy metals test, and they were showing some loading. If you're high in lead levels in your tissue, you're going to absorb mercury, they say, at about 100 times the rate. So sometimes these kind of run synergistically with each other. This metal attracts that metal. And you can also be born with a heavy metal load. A baby in some ways detoxes the mother. So sometimes lead burdens could have even happened from several generations back when your ancestor lived in an industrial area. So I find that kind of interesting. One of the tests that we used to give people or offer to people was called the Clifford test. That would test them on a whole different panel of different dental materials to see if the patient might have an allergic reaction before we placed that dental material in the patient. There's also one called the Melissa test. This one pictured here is the Clifford test, which is no longer available. Some people also do something called EVA testing, electronic voltage assessment, where the patient can be tested for materials. It's sort of a homeopathic way to test for people's reaction or potential reaction to a material. And so we at our office have just tried to strip down as many chemicals as we can, and we use a BPA-free tooth-colored filling material in replacement of these heavy metals. We also, in our water system line, and this is actually new as of 2020, the EPA finally regulated all dental offices. All dental offices are supposed to have this little R2-D2 looking situation in their water closet. All the wastewater from the dental office runs through this little R2-D2 capped small looking trash can, and this holds back from the wastewater any mercury or heavy metal that could be getting out into our wastewater, because traditionally dental offices are the #1 source of mercury contamination in our waters and streams. We do have some industry, but in the United States, it's a lot of dental offices contributing to this. And we stripped down our latex. We don't use any latex in our office. We use vinyl gloves and also a vinyl covering, which we'll see in a minute. We also have this high frequency evacuation system, air filtration system that also has a viral filter in there. We were really lucky we had a lot of this set up before COVID happened, because therefore we had a lot of the disposables and PPE equipment, patient protection, packaging and wrapping, so we could minimize aerosols in the office and help keep things as decontaminated from one patient to another as possible. So then we have a patient pre-rinse with activated charcoal. It looks very vile, but it actually doesn't taste like anything. And then we sit them down. We get them on an oxygen supply using a nasal cannula, and then we wrap them up. So this is, in a way, sort of like if you were going to have your appendix taken out, you would anticipate that your surgeon would kind of cover up the rest of your body except for that area on your belly where your appendix is going to be located, and then you would be asleep. The patient's actually awake for this. They're on oxygen, and we kid around about taking selfies at this time because you can't really recognize who that might be underneath there. Sometimes I use this gas mask looking thing, and sometimes I use a simpler and actually more comfortable for me, maybe not quite as effective for me, mask that can block out mercury from being inhaled. Some practitioners, the dental assistant and the doctor, this is me under there, will actually wear like an oxygen tank and be breathing oxygen as well, like the patient's breathing. Here's that high air filtration system. We say it's like an elephant trunk that's kind of resting on your belly, and that's kind of your friend. It's helping to suck out anything that's going to get removed. And we use we're using actually several forms of suction during the procedure. And then we take this out in as large of a chunk or a piece as we can. This is that wrap around the tooth. It's made of vinyl. We still refer to it as a rubber dam, even though it's not latex. And after we remove the filling material, we let the air clear for a couple of minutes while we get ready to place the filling. Sometimes we'll use ozone. Sometimes dentists use ozone in the prep, which helps cut down on sensitivity post-operatively. And here we are taking the amalgam out, and we get it out. And this is where we can finally do the filling. So we're using a lot of light curing material, again, BPA-free dental materials nowadays. And then after the patient leaves, we wipe down the office, the operatory, while the air filtration is still going on, the patient's gone, but we wipe it down with something that's going to attract mercury to get it off the surfaces, because everyone in that room is going to get exposed.
But mercury is not your only toxin. Our world is toxic, and there's other things that we can do in our environment to try to reduce some of our toxic burden. For example, most of us use somewhere between 1 and 400 different types of personal care products per day on our skin. And that's hard to believe until you actually stop and read the shampoo bottle, and then read the conditioner bottle, and then read the toothpaste label, and then look at the deodorant and realize that you have all these chemicals on your body. Well, your skin is a beautiful absorbing field, and it will take all those chemicals and put them into your immune system, into your lymphatic system. So detoxify your personal care products where you can. Use everything as natural, organic. Substitute coconut oil for lotion if you can. You know, there's lots of opportunities now. The Environmental Working Group is a wonderful place to rate your cosmetics so that you can see they've done a lot of testing on these to determine how disruptive they are to our own hormone and immune systems. So choose non-toxic personal care products. What about for home improvement? Paint. Everybody's watching HGTV now, and we all want the best, most beautiful new bathroom and kitchen. And through COVID, so many people embarked on home improvement projects that they ran out of lumber at the stores. Well, these home projects are often huge sources of environmental chemicals, between the formaldehyde that's emitted from the NDF board and the glues and the adhesives that things are used to stick to the floor and the walls, to the volatile organic compounds that come out of the paint. So you have an opportunity to choose better home improvement products. What do you clean your home with? Are you just using vinegar and baking soda, or are you using noxious, toxic chemicals? Look for non-toxic ones. Leave your shoes outside. There's stuff on the driveway from the exhaust from your vehicles. There's stuff on the lawn from the chem lawn or whoever came through your neighborhood and sprayed. So leave your shoes outside so that you don't bring them in walking in them. Have a separate pair of shoes that you wear only inside, or slippers if you like to keep your feet covered. Don't dry clean your clothes if you can help it. Avoid pesticides and herbicides. Use natural wherever possible. Select flame retardant-free foam products where you can. Limit foods high in animal fat. It's interesting that these toxicants really go into the fat. One of my friends is a fisherman, and the Chattahoochee River keepers have told everybody that if you're eating fish from the Chattahoochee River here in Atlanta, that the fat deposit that goes along the spinal cord of the fish is something you want to cut away and don't eat, because that's where the toxins from the rivers and lakes bioaccumulate. Well, same for butter, same for cheese. These are highly fat-dense foods, and that's where the toxins go. So choose your dairy products only organic. It's important that you do that. And as a human, with fat cells, toxicants dissolve in my fat too. The more overweight and obese we are, the more likely we are to suffer from a toxic burden. Use less plastic. Make a commitment to yourself and your world today. I swear to never use single-use plastic again. If you have a Ziploc baggie, promise that you'll rinse it out and use it one more time, even if it's to take out the trash, right? Do something with that Ziploc.
I love that, because
in our world
it's
today,
like 500
we are
years.
just so disposable.
Mm-hmm. It takes like 500 years for that to maybe break down. So
yeah, in our office we do thermal breast imaging, breast thermography, and one of our tricks is we put your hands in a Ziploc bag before we stick them in ice cold water. We make a point to hand every patient their Ziploc bag and say, please take this home and reuse it somehow. We don't care how you reuse it, please use it some way. Of course, keep mercury out of your diet, your home, and your trash, and then avoid canned foods and beverages, because the lining of these canned beverages, canned foods, often contain bisphenols. So BPA is among the worst. People recognize this. So the manufacturers are proud to say BPA free. Well, it has BPA-B or BPA-C or some other kind of bisphenol. So fresh is always best. Frozen is second. And canned would be your third choice.
And I was going to say, you know, we continually and regularly keep reevaluating the dental materials that we are using to replace these metal fillings, because it's BPA free, but that doesn't mean everything in it is just so good for you. You don't want to just be eating this stuff. So you still want to end up with as little man-made in your mouth as you can. And actually gold is a really nice dental material. It's fairly biocompatible. to it. You can get a really nice, highly polished surface, but a lot of people don't want gold for various reasons.
But isn't the best to not get a cavity in the first place? And
yes,
if you see your dentist early and often, you can avoid cavities.
Right.